We're very thankful that now I get to introduce not only a colleague, but a dear friend, Amy Pierre, who is a remarkable nurse practitioner who works at the Memorial Sloan Kettering Cancer Center and is really dedicated to the field of myeloma, has taught me a great deal about myeloma and the care of patients. And we've asked her to address this topic of communicating with your healthcare team, a two-way street. So it's not just a one-way street where we become the recipients of a doctor's soliloquy. And so I'm going to turn it to you, Amy, and please share with us what you've prepared for today. Thank you so much for being here.
Oh, thank you so much. Good morning, good afternoon. It's a pleasure to be here on your screen today. As Dr. McHale said, and again, I am a huge Dr. McHale fan as well. My name is Amy Pierre. I'm a clinical director of Flatiron Health, a nurse practitioner at Memorial Sloan Kettering in their myeloma lymphoma division, and a member of the International Myeloma Foundation's Nurse Leadership Board. Today, I'm going to talk to you about some key concepts, including partnering with your healthcare team, understanding signs and symptoms of myeloma and risk factors for myeloma, as well as side effects from treatment and how to prevent them and manage them. And most importantly, how to effectively communicate with your healthcare team. I really love doing these programs because they're all patient-centered and they're really designed to, empower the patient to advocate for themselves by actively participating in their medical care. And Dr. McHale spoke on this slide a bit as well, some statistics on myeloma being rare, but we also learned that it isn't as rare for some folks. We know that myeloma can be more common in African Americans, also those with first-degree relatives. So because of this increased risk, it's important to arm yourself with the knowledge of what signs and symptoms of myeloma look like and speak to your healthcare team about how you're feeling. And also, given your risk assessment, if you should be screened for myeloma. Don't keep this valuable information to yourself. It's important for everyone in your family and your community to understand what this disease is so that they can assess their risks and speak to their healthcare team about it and learn more. So how is myeloma typically diagnosed? How do we know how to look for it in a patient? There really is 3 avenues in how myeloma is discovered. So one, it could be patients going in for their routine checkup and on looking at their lab work, such as their complete blood counts and their chemistry panel. We see some abnormal labs that could be suspicious for myeloma. And there could be early signs, meaning the patient may have no symptoms at all or tiny symptoms, or it can fall into the second scenario where their patient is seeing their provider for evaluation and management of a specific symptom. They could have increasing fatigue or bone pain or just generally not feeling well at all. And those labs could show some abnormalities. And the pain that they may be experiencing could prompt further workup like an X-ray. But both of those situations, because patients have mild or no symptoms at all, they're not usually an emergency situation, so they're first discovered and evaluated in the office. So it's really time to discuss and understand what's going on and being evaluated. But the third scenario is more emergent. You could be, so sick and symptomatic that it could require an ER visit. And this is where we find issues that require inpatient management. It could be kidney failure or bone fractures that could be compromising important parts of the body, such as the spinal cord. So it's really important to understand that myeloma could be discovered incidentally, or when someone has mild symptoms, or when there's such a high level of the disease that we now have an emergency situation. And another reason why I really like these programs is because they're really patient-centered. And we also know that it's important to advocate for our patients and have them be equipped to advocate for themselves by actively participating in their care. We want our patients to partner with us and work together as a team to battle myeloma. And we know it takes a village. Although your life as a patient can be filled with appointments, there's a reason for it. It takes a multidisciplinary team to take care of you, and everyone really plays a role. So to take charge of your care, you need to know who's on your team. Get familiar with their roles. And once you know who's part of your care team, then you can have sound input on treatment and disease. So first and foremost, your PCP, your internist, is important. So please don't leave them out. A lot of patients start trimming down their provider list, but their primary care physician sometimes gets left behind. But, because you see your myeloma team so often, but you need your PCP. They monitor your blood pressure, your lipid panel, your general health care from head to toe. And because your oncologist or your myeloma specialist is laser focused on your myeloma, they can't manage everything. So your primary care physician really is that umbrella provider for everything. And understand the difference between your oncologist and your subspecialist. Maybe you might have a kidney doctor known as a nephrologist, or even a cardiologist or an orthopedic specialist, and understand how they interrelate. And you may have a myeloma specialist taking care of you, or a general oncologist, and they may work together to tackle your myeloma. And actually, someone asked today about having a myeloma specialist care. A myeloma specialist being important in your care. I would say having a provider who specializes in myeloma, or a provider who has a high volume of myeloma patients driving your care or being even involved in your care is important, because studies have shown that patients who see a myeloma specialist or even have a provider who has a high volume taking care of them, they have better outcomes. So try and see if you can see a specialist to be a part of your care as well. And all the additional healthcare providers on your team, such as the allied health staff, find out who they are and what they do. Understand the difference between a nurse practitioner, such as myself, and a nurse. Understand the difference between your office practice nurse, your infusion nurse, your research nurse, and the specific roles they have. Surgical oncologist, radiation oncologist, dietitian, pain specialist, pharmacist. The list can be massive. Understand all their roles and make sure everyone's communicating. And your caregivers, your family, they're your support network. They're your important eyes and ears that advocate for you. It's not inappropriate to ask who someone is on your team, what role they play. And I can't underscore enough that knowledge is power. So ask questions about your labs, about your markers, so you can participate in key decision points. It's important for us to know what's important to you, so we can know what to focus on in visits. So what questions should you ask your healthcare team to understand your risk? Know your family history. A lot of families may not go in depth about the medical history of their family, as they may not know the details, but it is important to ask. But also know the risk factors of myeloma. And by risk factors, I mean, we know that myeloma occurs more commonly in people who are Black, the male gender, older folks, and people who may be overweight. But know the symptoms. I always tell my patient, no one knows their body better than themselves. If you have a new symptom that's concerning to you, something that's lingering, just like how, Yalik said, he had that lingering cough, listen to your gut, get checked out. The two most common symptoms of myeloma is lab abnormalities, such as being anemic, which can make you feel tired or short of breath, but also bone pain. Could be in the back, the ribs, the arms, the legs, anywhere really. And if you're being treated for myeloma, talk about how you're feeling to see if you're experiencing side effects from treatment that we can help with. Feel free to ask questions about your test results your team conducts, so that you can understand the results and what they mean and what really is clinically significant, because we run a lot of blood work and we want you to focus on the most important labs that we draw and ask about treatment, why you're on that treatment, so you know that it's the best individualized treatment plan for you, and maybe what other options that you might have. So let's talk about symptoms, side effects and symptoms a little bit more, because they both can occur and why they occur. Myeloma itself and the treatment can cause symptoms. So for example, myeloma cells, they can make your bones more fragile, more susceptible to fracture, causing bone pain. And this sort of widespread bone destruction can cause calcium to leach into the bloodstream that can raise your calcium levels. That can make patients feel confused or constipated or even nauseous. And the myeloma cells divide and crowd out those normal cells in the bone marrow, causing anemia, making people feel tired and weak and short of breath, even lightheaded at times. And overproduction of the myeloma antibodies suppresses normal antibody function. So patients' immune systems can be compromised, leading to higher risk of infection. And we know these myeloma proteins can be toxic to the kidneys. But tricky enough, symptoms from myeloma, our treatment can overlap. For example, anemia and low blood counts, we know that's from the myeloma, but the treatment can do that too. And peripheral neuropathy can be related to the myeloma or the treatment itself. So be aware of some of these symptoms that are listed on this slide and the side effects. And the key side effect management is sort of knowing the source of the side effect, try to prevent it. And then if it's occurring, manage the symptoms as best we can. So this is a really important slide, because we're talking about the drug that everyone loves to hate, good old steroids. But remember, almost all myeloma therapies work better in combination with steroids. And some of those steroids that we use we can't really get away from at times. And that includes dexamethasone, prednisone, methylprednisolone. They're important, but they can be tough drugs to tolerate. You can see they can bother every system of the body here. Looking at from head to toe, it can cause issues with, your eyes, your gut. It can cause you to retain fluid, stomach upset. It's important to be on something to protect your stomach. So, and it can cause cataracts with long-term usage. So it's important to discuss all these particular symptoms with your primary care team who's managing your myeloma. And for long-term therapy, for example, patients who are on daratumumab, lenalidomide, and dexamethasone, a lot of physicians now are only dosing the steroids on the day of the infusion to help avoid some of these long-term toxicities after several cycles. And there was a new study that was published last year that found that switching to a lower dose of like lenalidomide and even stopping dexamethasone after several months, like 9 months, not only was it safe, but it also yielded similar outcomes compared to patients who received sort of continuous lenalidomide and dexamethasone. Let's talk about the stomach. So we can see GI symptoms with our myeloma therapies, including diarrhea and constipation. And then it's true that some patients can really fluctuate between both of them, right? So we know that patients can get diarrhea related to their drugs, and also related to other things that they may be taking, such as supplements. So it's important to know everything that patients are on. We also know that it can also cause problems. We can see that you need to increase your fluid intake if you're having a lot of diarrhea, because you can get dehydrated really quickly. It's important to take anti-diarrheal medications to stop and slow that diarrhea. And then there's other things that can cause constipation, right? Aside from your myeloma drugs, it could be opiates, those pain medications, certain supplements. So it's important to increase fluid. It's important to increase fiber, even natural fiber, such as what's found in your diet, or supplemental fiber. So work with your team to see what works best for you, and see if we can tweak some of the medications that you're taking to help manage a lot of this toxicity. So let's talk about clotting. So deep vein thrombosis, known as DVT, and pulmonary embolisms, known as PEs, or clotting problems, we take very seriously. And risk factors for this could be you have a personal history of a clot, or a familial history of a clot, or sedentary lifestyle. And symptoms of this could be swelling or a tightness in your legs, a pain or an acheness or redness. Sometimes the clot can travel to your lungs. You can have shortness of breath or chest pain or rapid heart rate. So we know how to manage this. We need to give you blood thinners, but we also know how to prevent this, right? So if you're on medications or have high risk, that's basically on a risk assessment scale, we need to give you blood thinners to prevent clotting from happening. And other things you can do as a patient, good weight management, and also no smoking, and also moving as much as possible. If you're going to be, for example, on a long flight, make sure you get up and move around and sort of shake those legs. So peripheral neuropathy, it's a very frustrating side effect for patients. It's damage to the nerves that it can really manifest as numbness, tingling, or pain, or just a funny sensation. I've had patients tell me it feels like they're, walking on rocks and they're not, or they're wearing socks and they're not. So it can manifest differently. So discuss this with your team and report it early. We're going to ask you about it at every visit, because we know that 2/3 of neuropathy is reversible, meaning 1/3 it's not. So we really need to get ahead of it. So we'll always be asking about how your hands and feet are feeling. But there's a way to mitigate this. We know that giving certain medications like bortezomib as a subcutaneous injection can lessen the risk of neuropathy. Also giving it weekly versus twice a week. But there's other things you can do. For example, there's a study that showed B complex vitamins can help. That's including B1, B6, B12, and folic acid can sometimes be beneficial as well. And we also know that even sort of topical solutions can be beneficial as well. But reducing your dose of the offending drug is important, or even using prescription drugs that target nerve pain can be helpful as well. And even physical therapy can be helpful. So emotional side effects from myeloma or myeloma therapy itself should not be forgotten, and it can truly influence every aspect of a patient and their caregiver's life as well. So fatigue, depression, anxiety can affect quality of life. And we even had an audience member talk about quality of life and how important that is. And there could be several sources for fatigue, anxiety, and depression, right? It could be pain, it could be anemia, reduced activity, difficulty sleeping, toxicity related to treatment, or financial concerns or end of life concerns, or maybe changes in what's happening in your life, or even sexual dysfunction. So there's a myriad of ways we can manage this, right? The number one way to combat cancer-related fatigue or treatment-related fatigue, time and time again in the literature, is exercise. And I'm not saying you have to run a marathon, but even a walking program, yoga, anything that you like to do to move your body, and proper rest. So if you're having trouble sleeping, talk to us about that. We can help you with proper sleep hygiene and even ways to help with insomnia, including medications. Supportive networks, support groups, your faith, even meditation, counseling can all be helpful too. Mindful-based stress reduction, certain medications to help manage anxiety and depression, supplements if appropriate, so make sure you're talking to your provider to see if it's appropriate. And we know this is a very real side effect that needs to be mitigated. We know that the majority of patients experience fatigue, but only a small percentage of them talk about it. So it's really important for you to let us know this is going on so we can really help you with it. And now let's talk about infection. It's always been an important topic, but even more important nowadays is what's going on in the world. We know that it's important for myeloma patients are 7 times more likely to be infected than the general population due to their myeloma, and they have a delayed recovery of infection. They have this compromised immune system, not just from the myeloma, but from treatment. So we need good personal hygiene, right? Good hand washing, avoiding sick folks, good oral care, and even growth factor support if your counts are low. Immunizations are important. So getting that flu vaccine, getting your COVID vaccine, getting your pneumonia vaccine, avoiding live vaccinations. We now have a zoster vaccine that we can use for patients that's not live. And then some patients may need medication to combat or prevent infections if they're high risk. So antibacterials and certain medications can increase your risk of viruses that we give for myeloma. So being on an antiviral is important as well. But if you're feeling unwell, you have a fever, 100.4 or greater, shaking chills, dizziness, short of breath, sometimes it could be an infection brewing. So let us know, because we know how to look for infections and manage it. And then another audience member talked about something really important, which is financial toxicity. It's a symptom. It's not a physical symptom, but it's a real side effect from treatment. High burden cost of care can be from high premiums, copays, travel expenses. Have we seen the cost of gas lately? Supplies for your medical care, the cost of prescriptions, maybe a loss of income due to the inability to work, or high appointments. And then let's not forget your caregiver. That person may have missed work as well because they're caring for their loved one with myeloma. It's important for patients to understand you're not alone. There's resources out there to help with cost of care. So talk to your medical team who can put you in the right direction. A social worker or a financial navigator in your office, financial assistant team at your medical center. There's programs, and even on the right side of the screen, you can see specific resources at the Levine Cancer Center. They have a financial navigator team. We also have specific resources at the IMF, including the info line, and you can see national resources too, including resources for drug expenses, travel expenses, and special conditions such as for our vets and more. So sometimes patients arrive to their appointments and they're so overwhelmed with what to ask the provider, they forget their questions, or they don't even know what to ask. So we want you to help get the information you need in the most out of your appointment. So we have this treatment discussion tool that we've designed to keep the patient in the forefront and understand the patient's preferences. So ask important questions such as, what can I expect now? What can I expect in the future? And don't ask these questions once, ask them many times. These are important conversations to have when your treatment is no longer working and you're switching to a new treatment, or you have important life changes, or your priorities or goals have shifted. Talk to us and tell us what's on your mind so we can best support you, because having myeloma is hard And that's not lost on us as your providers. So prepare yourself for each visit. Tell us what's important for you. Ask us, how effective is this treatment? What will my quality of life be like if it's going to be affected? What are the risks? What are the side effects? What are my alternatives if there's any? Write your questions down and bring them in. Take notes. If you don't want to take notes, if you just want to sit there, absorb, bring a friend or a family member with you, appoint them as your secretary to be a second pair of eyes and ears, have them take notes for you. These conversations in the office can be complex and layered, and you may need time to think about it. That's okay. Ask if you can have some time to mull it over, and never stop learning. We're so fortunate that the treatment landscape for myeloma is rapidly changing year by year. So always learn about the latest and greatest, and ask for us to give you reputable sources to look at, like the IMF, because we want you to learn alongside it with us too. And, we have many resources to help you out. We have medication pamphlets, including our new daratumumab pamphlet. These pamphlets give you everything you need to know about your myeloma treatments. We have comprehensive information about myeloma on the website, support groups across the country, our myeloma TV series with Dr. Dury, which are so popular and fabulous as he breaks down the information you need to know from the latest myeloma conferences or even new treatments that's been approved, and our info line that I mentioned before, which is essentially phoning a friend on myeloma. They have questions, they can answer any questions that you have. They're a wonderful resource to have. They eat, breathe, and live myeloma information day in, day out. So I provided a lot of information for you today. I know it's a lot. I hope you found it helpful. It was really a pleasure to have a chance to share this with you and share it with your friends and family in the community. And I really thank you for your time, and I'll pass it on to our next speaker.